cardiology can be intimidating to a lot of other specialties. So I think just by virtue of you working in cardiology, you already get a little bit more street cred.
Today we're going to talk about what it's like to work in cardiology. I am joined by a fellow PA who works in outpatient cardiology. His name is Greg. Thanks, Greg, for joining us today.
Yeah, happy to be here. Thanks for having me.
Cardiology, it's a big specialty, lots of different areas of interest. Do you have a particular focus in your practice?
I do, yeah. I mainly see heart failure patients.
Okay.
Heart failure, reduced ejection fraction, or HFrEF, or systolic heart failure, ischemic or non-ischemic cardiomyopathy. All of that is pretty much what I do on a day-to-day basis. And, there are times where I catch myself and I'm like, I don't want to be that guy and correct them about, no, it's actually this type of heart failure, not that kind. But sometimes it's important to do that.
I assume in cardiology, the population that you're working with the most are more geriatric.
Actually, pretty much anybody from 19 to 100. I work with an extremely diverse population of people that are either at the poverty level or lower. And I get to see a lot of different aged people with the same disease, which is pretty wild. But typically speaking, you're right. Like you would be dealing with a lot of middle-aged folks, geriatric folks, because that's usually what you think of when you think of heart failure.
So you're saying that's not your majority of patients, or are you just saying you can see the gamut?
I would say, my older patients probably make a third of all of the patients I do. Probably another third of 20 to 40 years old, and then 40 plus is the other third.
Normally, younger children and people with severe heart disease would have passed away.
Yep.
But now they graduate out of pediatric cardiology and they're being seen in regular cardiology practices.
It's true. Yeah, it's pretty amazing how much longer people can live now.
Are there things in cardiology that have been a surprise to you?
I didn't realize such young people could have heart failure. And in the context I work in, impoverished people, homeless people, a lot of it's from drug use. So you'll see a lot of non-ischemic cardiomyopathies from cocaine, meth, alcohol. How sick somebody can be at an early age, I had no idea. It's just hard to see that all the time and not see any resolution in it.
Right, and to know that it was completely preventable.
Yes.
So that leads me into thinking, what are the things that you really love about cardiology?
Yeah, I think that, and this is a really unexciting answer. Okay. So there's not a lot of flash and bang and glory. I think it's what's most needed in a lot of places in the world right now, which is you get to be consistent with patients. Yeah. You focus on things that are not fun to talk about, like lifestyle, weight gain, foods that you shouldn't be eating, and then, doing the same things every day, which just sounds like a really boring thing to think and talk about all the time. And it is, but it's also the most important stuff we could do. Helping people establish some aspect of consistency in their lives. And, for what I do, that's taking medications, coming to clinic, getting labs, but also just talking to them about doing other simple things, which I don't know if that makes a lot of sense, but that is the real work of medicine, I think.
Honestly, that's why there is so much heart failure in the United States, especially is lifestyle choices. But it's also one of the hardest things to affect change with people.
Yeah.
So what do you think are the downsides of cardiology, the reasons that people might not like it working especially?
Yeah. Ooh, the good stuff. Yeah.
Yeah. Tell us all about that stuff.
So, geez. The first thing that comes to mind is that it's kind of crazy intimidating to just jump into, because if you're in a hospital and you're rounding on a patient that's having a heart attack in the ER, and if there's any question in your head that you don't know what's going on, that can be terrifying, because everyone is looking to you to make the right decision. Yeah. So that can be really scary. But if you get maybe 5 or 10 of those experiences under your belt and you go back and you do your homework, then you very quickly are able to put things together in a really safe and logical way that makes sense. So intimidating is probably the biggest one. The second one is, depending on where you work in cardiology, you might have a lot of different cardiologists that you interact with. And it can be good and it can be bad. It can be good from a sense that you get a lot of different perspective. You know, no way is the right way sometimes. But in other cases, there is only one right way. And so if you don't have like one consistent mentor, it can be really, really hard.
Is the whole clinic that you work at, is it a heart failure focused clinic, or have you kind of developed your own little niche within a general cardiology practice?
It's a multi-subspecialty cardiology space. And so there's general cardiologists that have clinic there, there's electrophysiology, and then I work with a board-certified heart failure subspecialized cardiologist.
And do you feel like in the world of cardiology, at least the world that you rotate in, that PAs and NPs get a fair amount of respect?
I feel like they do. And I think it's because when you're in cardiology and you're tucked in that corner and that's all you do all day long, people tend to respect that, particularly when cardiology can be intimidating to a lot of other specialties. So I think just by virtue of you working in cardiology, you already get a little bit more street cred.
What kind of personalities do you think are well suited for working in cardiology?
I think people that are chill without being like ultra chill to the point where someone's coding and you just don't care. Like that probably wouldn't be a good idea. But I think somebody who doesn't get too frazzled when crazy stuff is happening, because it will, and somebody that other people can look to, whether it's like a floor nurse or another, provider who's rounding on the same patient, somebody who that person can look to for answers, that is going to be organized, diligent about getting their note done. So I would say somebody who's laid back but organized, and probably not somebody who's easily stressed out about things and worried about the worst case scenario all the time. It's good to have a healthy appreciation of fear and concern, and to, look for potential aspects of what could go wrong, but not necessarily be paralyzed in fear.
So the one thing about cardiology that people have to realize if they're going into it is that death is pretty much a fundamental aspect of the specialty. You're not going to be able to save everyone, and you will lose patients. How has that been for you? Any thoughts on that?
Yeah, so it's true. You're in a specialty where people die a lot, and when it hits hard, particularly when you know these people. It's easier when it's expected, and you see this coming like a mile away. That doesn't hit as hard, but the specialty just, by its own nature, I mean, cardiology can be very erratic and sudden, and people can just die. And so you do the best you can to prevent those things, but they are going to happen. And so how you deal with that as an individual, I think, is going to make or break you. For me, it reminds me that life is really delicate and fragile and fleeting, and it makes you cherish life so much more than I think other people in other specialties.
Right. And even, like somebody working in trauma or emergency medicine, they probably deal with a lot of death as well. But I think one of the differences is that normally those are people that they don't know, that they haven't developed a relationship with. It's it's a person coming in. It still is hard, but in cardiology, you have, for most of these patients, had a long relationship with them. These are people you're seeing every 3 to 6 months, and that's got to be a harder aspect of it when you lose the patients there.
It really is, and learning to deal with the pain of losing a relationship, because that's what it is. I mean, it's not unprofessional because it's a relationship. If you don't have relationships with your patients that you see regularly, like, who are you? I mean, maybe that's okay with a lot of people, but I think if you don't have some aspect of connection, you're not gonna be as motivated to help them. And so finding ways to deal with that is key. One thing that I do is, if a patient dies and I'm really struggling with it, I'll just write about the patient for however long it takes so I can get it all out, and then that helps for me.
Have you been seeing heart failure from COVID?
Yeah, and it can happen for different reasons. One of the reasons I see is, in the earlier waves of COVID, you would have a lot of different coagulopathies. There are patients who would have thrombus in their coronaries, and they'd have to, dig it out. If it was fast enough, you could save the heart. If you couldn't, then, that region of the heart is damaged, potentially forever. And so that's been hard to see on really young patients.
Anything else with COVID?
Yes. In the earlier kind of waves of coronavirus, And I think this was an appropriate reaction because we just didn't know what the heck we were dealing
Right.
with. As a healthcare profession and society, we just prioritized all of that.
Right.
And everything else kind of went by the wayside. And that manifested itself, the shadow side of that manifested months to, we're still dealing with this. People who put everything else on hold, they didn't see heart failure follow-up visits, they became substantially volume overloaded, or other people, who had cancer, who,
Right.
didn't get their chemo because the infusion center was down or something like that. So,
Did your clinic close at all with COVID?
yeah, there was a time where everything just went to telehealth for, I can't remember how long. It felt like a couple months, and it got to the point where we had to, make the case with our powers that be that we can't treat for these people in the way that we need to
Right.
unless we see them face to face. But now obviously we know more and things have changed and we've become more nimble, I think, as a healthcare society. We're like, okay, can't see you, let's do telehealth for this, but then maybe come in a couple weeks later.
So that's what I was going to ask is telehealth kind of just a standard part of your practice?
Yeah, it is. It's definitely not for what I do and what a lot of cardiology providers do. Depending on who you ask, it's not like the end-all be-all way of seeing patients. A lot of general cardiologists have preferred just only doing telehealth because, you can kind of get away with that because you're mostly just talking about symptoms.
Right.
And you don't need to see them there for it unless you wanted to listen for a murmur or
Right.
get an ECG.
Right.
But even now, like technology is coming out where you can deliver a remote ECG system to a patient. They can upload their blood pressure, their rate, their ECG, vital signs. All of that could be ready before a telehealth encounter. And that's kind of where things are heading. But I would say for what I do, about 90 to 95% is face-to-face with an occasional telehealth visit here and there. For instance, I mean, one thing that I do, and I won't name like company names, obviously, but there's like remote heart failure technology where at any point I can tell a patient to utilize this thing they have at their house, upload a reading to a cloud, goes to a server somewhere, and then I can see how overloaded they might be.
Wow.
Like that's huge. And so I think we're going to see a lot more of that and a lot more, like you said, remote technology.
Yeah. Now, how long have you been working in cardiology?
I've been working for about 4 years total in cardiology, just right out of school.
Okay.
And my first job, it was more of a general cardiology, so pretty much every flavor and color of cardiology.
Okay. Did you know that you wanted to work in cardiology when you were like in PA school or even before PA school?
Not really. So in your didactic training, when you're in the classroom and death by PowerPoint for, 12 hours a day, cardiology block actually kicked my tail quite a bit, and it was kind of intimidating. So definitely didn't think that's what I was going to be doing. And then I did a rotation where I actually really liked it. And so after that, I was convinced that that's what I wanted to do.
Okay. What kind of hours do you work on a typical week?
Yeah, so really great hours. I'm very fortunate. So I work about 8 to 4 every day, Monday through Friday, no weekends, no call. I like it that way.
So when we say 8 to 4, like, are you actually arriving in the office at 8 and actually leaving at 4?
Yes, so I'm pulling up to my parking space at about 7:45 a.m.
Wow.
And then I scurry over to the hospital, which is where I start my day, and then I round. Half the day is over. I then go to clinic. I pre-chart during lunch, and then I scurry over to clinic. And then, by around, maybe I'm lying, maybe about 4 to 4:10 or 4:15, no later than 4:30 do I stay at work. I'm out the door and I'm on my way home.
With charting done? For the
Yes.
day?
What? Yeah.
Wow.
I prefer to lock things up and work hard start to finish so I don't have to spend forever charting after work.
What's your patient count? Like do you work a full day in the clinic ever, or are they always split days?
I used to work a full day in the clinic, and it kind of shifted to a half day once the pandemic started and staffing was a big deal, and it moved to just a half day every single day of the week.
Oh, okay.
Yeah, and then the patient load for me as somebody who treats heart failure patients tends to be about no more than 10 to 12 patients scheduled in a half day. And depending on who actually shows up, that might be 8 patients in a half day total. And then for inpatient, honestly, it depends on the week. In holidays, the hospital tends to slow down a little bit more. And then after the holidays, things kind of crank up and ERs explode. And, we might have like 8 to 12 patients on the service on a daily basis on a busy week. And then on a slower week, it might be about 4 to 6, depending on what's going on.
Are you doing consults also?
Yes.
You go down the ER and do consults? Are you running anything like stress tests or anything like that in the hospital?
Yeah, and it's one of the more, I would say, unsavory aspects of the job. If you're a cardiology APP, you have to consent patients for stress tests, which means that you kind of give a manuscript, regurgitated thing that you say multiple times a day to different people, and then you document the interaction with the patient. So that can get a little bit rote and unexciting, but it's just one of those things that's part of the job. I don't necessarily have to supervise the stress test the whole time. That is something that some APPs in cardiology can or do, also do. That's probably not something I would want to do all day long, but to each his or her own.
Are there any procedures that you do?
I don't do procedures. I'm cool with that. I know some people can and have done that. For instance, and this is a very, very narrow and specific example. There's not like a ton of people I know that do this, but for instance, in California, if you're an APP, you can do like a diagnostic left heart cath, which is pretty wild to think about. But, it just depends on, what the hospital is cool with, what are the state laws, things like that.
So when you came out of school and you started working cardiology right away, first stop out of school, was it with a different group or is it where you're working now?
Yeah, it was with a different group. And so it was with like a kind of private practice, multi-specialty group, and then I was in the cardiology end of that group. And there were a lot of different cardiologists at the time, and I would round on patients with a different one like every week. And so, again, great in the sense that you get to work with different personalities. Some of them are hilarious, some of them not so much.
And learn little tidbits from each one, because everyone has something that they're really good at.
Right. However, it's hard to really grow as an individual if you don't have like one person kind of holding you accountable, pouring into you,
Being a mentor.
Making for sure you're motivated, figuring out what motivates you. And
knowing what you know now, if you were going back and looking for a first job in cardiology, whether you're transferring specialties from, if you're a family practice PA and then you want to transfer into cardiology, or if you're coming out of school, what advice would you give people to look for to find that kind of mentor situation? Or do you have any advice?
That's hard. I honestly feel like it's kind of like luck of the draw, and then kind of doing some background investigating and figuring out who it is or where you're going to be working with. Like that is key, because it's hard to just say yes to a position and then just cross your fingers, hope things work out well. It happens all the time. So I'd say do your homework, know where you're getting into, who you're going to be working with.
So if you're going into a practice that's got multiple physicians, I assume you would want to know, am I working mainly with one particular?
Yes.
Or am I just spread throughout the whole group? And if it's a spreading situation, that might not be the best situation to walk into for your first cardiology experience. Anything else beyond that? Any ideas?
Yeah, I think kind of having an idea of what you're comfortable with, what you're not comfortable with. If you don't want to be doing electrophysiology stuff all day long, and that's because it's very complicated. There's a lot of ins and outs with that stuff, and if that's not what you want to do, then you got to know that. But if you just want to do something like general cardiology and deal with like post-cath patients, or send them to the cath lab or something like that, then that's totally fine for a lot of people.
Obviously depending on the practice itself, but do you know if a lot of PAs kind of make their own niche? Like, do you have the option, do you think, in general cardiology to kind of say, I really like these kind of patients versus others?
Yeah, I think so. If you kind of develop a preference for things, you can communicate that to the people who schedule patients, or even the cardiologist you might be working with, so that you can have like some self-preservation and you don't get burned out immediately.
it seems like you've really enjoyed kind of moving into that particular niche of heart failure.
Yes, yes, and you bring up a lot of really great points, and it's good that we're talking about this because I think it's really easy for somebody to go into a job and just hope that things work out well without really communicating preferences, your limitations, things that you need for yourself to be successful. All of that has to be done. And I had to do all of that. There were things that I didn't want to do that I had to communicate, whether that's, no, I don't want to see 15 patients in a half day, which, no one's asking me to do now. But, as you start kind of gearing up, people are always going to want you to see more. And so if you don't have hard and fast boundaries, people aren't going to know what they are. And that's really, really important.
Right, and I think especially when you're a new grad, or if you're trying to break into a specialty or just get a job that you really want, it's tempting to just be like, I'll do whatever, type thing. But I think that if we realize how valuable we are medical providers. We are bringing in money into practices, significant amount of money. It is important for us to be happy in the positions that we work in, to be productive for the practice. So it really is best for all the parties involved to kind of be upfront and really talk about what you might envision, things you want, and things that you can contribute to them that they may not think about.
You want to be an asset. You want to be an ally. You want to be available, right? But you also don't want to be like steamrolled all day long. And so it's a hard thing to do, but it's important to learn to be tactful about, yes, being a team player, but knowing where I begin and knowing where I end. And once you kind of let people know that, it creates a better work environment. And that's a hard, long battle, and it's rife with people getting upset on the initial end of things. But once it happens, people get used to it, and things are better for everyone else.
So do you think that you just got really lucky in the position you're in as far as the amount of patients you see and being able to keep that schedule? Or do you feel like that cardiology is, as a whole, that, other colleagues and people that that work in cardiology, that the schedule tends to be lighter and the hours tend to be better on a whole in cardiology?
Man, I can only speak for myself and, the people I work with in the same group. But yeah, I think they are. I think in general, if you want to have a clinic type situation, it's going to be more fixed. And then also, even on a rounding basis, there's always going to be, at least in my situation, a cardiologist that's on call, depending on what group you're in. Fortunately, I don't have to have a pager at night.
Nice.
And if I did, I'd probably want to get compensated for that in a pretty big way. But again, you have to communicate that stuff. Otherwise.
Yeah. Is call fairly common among PAs and NPs in cardiology, do you think?
I think so. I think some people are in those situations where, they have to field the consults at 3 a.m. Yeah, that exists. There might be like a PA in cardiology, nurse practitioner cardiology watching this and be like, wow, that guy has a sweet deal. How the hell did he figure that out? And then my answer would be, you have to know what you're getting into. We kind of talked about that before, but also, fortunately, the lucky part of this is the physician I work with communicates, you should not be doing any more than this.
Okay.
If you are to actually do a good job, be thoughtful, be thorough, and have a good product on the basis of your follow-up visits, things like that.
Now, the first practice that you worked at out of school, what kind of hours and patient loads were you seeing there?
So it was all inpatient, and I'd have at any given day at least 4 patients in a hospital that I would round in, and these were like private, for-profit hospitals mostly. So they would have multiple different cardiology groups contracted with them, and on any given week it would be that respective cardiology group's call week.
Oh, okay.
Some days and some weeks we would be on call on 2 separate hospitals at the same time, which is really stressful if you're the only person going between the 2 places. So we would have anywhere from 4 to 10 patients in a hospital at a time at just one hospital, and then multiply that by 3 sometimes. So sometimes 30 patients that you're rounding on, and doing consults on, and that's just a lot. It's not like a good recipe, in my opinion, for a happy and satisfying career.
So what were the kind of typical hours in that job?
Yeah, so I want to say like probably 7:30 to sometimes 6 p.m.
Okay.
Some days. Some days, you know, here's the good side of that kind of job though, is you don't have clinic, right? So if you're done rounding on everybody, locking it down, if you're a boss and you're super efficient, maybe you go home at like 2 p.m. That can be like a good part of it, but it's not every day that can happen.
How did you find your first position?
Every job I've ever had as a PA, and so far that's just two, it has been from somebody I know or somebody who knows somebody who works at a place that has a need and they're looking for the spot. I know you're interested. Do you want to do that?
So networking.
Yes.
Is so important.
Yeah.
So you came into cardiology as a new grad. Do you feel that cardiology is a good first job for new grads, or looking back, do you feel like it would have been better that people maybe should do family practice for a while and then transition?
There are a lot of perspectives about this. It has been said to me that you should do internal medicine for, I don't know, a couple of years before jumping into cardiology. But I think whenever you make that jump, it's still going to be totally different than what you were doing.
Yeah, steep learning curve. No matter.
Right. So I don't really think it matters so long as you have a mentor that is going to pour into you and take the time to really make you good and make you capable at doing a good job. So I think it just depends on who's training you and how okay are you with not knowing something that is really complex and overwhelming.
Yeah. Do you have any particular resources that you really like to use, books or websites or anything?
Yeah, so most people know of like ECG books. I don't endorse the product, whatever. The American College of Cardiology has a lot of journals that are super helpful, just refreshing yourself what guidelines exist, because ultimately if you're rounding on a patient and you know a hospitalist is asking a question on anticoagulation, what are you going to fall back on?
Right.
Not what you think is right, but the guidelines. So knowing those, memorizing those, being up to date with those, that's the best thing I think you could do.
Is there anything else that you think you'd like to mention about cardiology for people thinking about going into this specialty?
Yeah, since we're going into a new age of medicine with telehealth, if you're somebody that enjoys the academic aspect of cardiology, but you're not crazy about seeing patients all the time, it might be that in the future you could just be somebody who does remote monitoring or, you know, telehealth visits with people and check in on them.
Well, thank you, Greg. I appreciate you joining
No
us
problem.
and sharing with us what it's like to work in cardiology. Wish you all the best in your career.
Thanks.
I hope that you found this interesting and learned whether cardiology might be right for you. If you're still looking, check out some of the other videos I have listed here. Thanks again for joining us. Take care, and I'll see you next time on the Medicine Couch. Bye.